Hello, my lovely friends. Welcome back. So, in this video, we will discuss about the mountain sickness. Mountain sickness is a very important topic, not only for the MCQ part, even for the practical part as well. So, let's learn about this mountain sickness, physiology, pathology, and the pharmacology and medicine part. So, let's begin. So, first we should know that what is the mountain sickness. We can also known as a high altitude illness. और इस वीडियो के अंदर पे अपन बात करेंगे that what is the definition of the mountain sickness, what is the type, what is the treatment, and what is the trick to solve the MCQs. And this is the repeatedly asked topic in the various examination in FMGE, in NEET PG, and in INI set. So guys, after watching this video, I guarantee you that you will be able to solve any kind of questions from this mountain sickness topic, right? So let's start. So the mountain sickness, the definition is that this basically occurs due to the decreased atmospheric pressure at high altitude. So whenever we go up to the mountain, जब अपन ऊपर चढ़ते हैं हाइकिंग के अंदर पे और ट्रैकिंग के अंदर पे, तो व्हाट हैपन्स, द एटमॉस्फेरिक प्रेशर, जो अपनी ग्लोब का, जो अपनी पृथ्वी का प्रेशर है, द एटमॉस्फेरिक प्रेशर विच इज ऑल्सो नोन एज बैरोमेट्रिक प्रेशर, वी ऑल नो that whenever we are going to the upside, the barometric or atmospheric pressure drops down, and whenever we are going below to the sea level, this pressure is actually increases. So when we are going to the upside, actually the atmospheric pressure decrease, and so that all the gases which is present into this atmosphere like CO2, like oxygen, nitrogen, all the partial pressure of these gases also drop down. तो जब उनका पार्शियल प्रेशर ड्रॉप डाउन होता है, ड्यू टू दैट व्हाट हैपेंस दैट दीज गैसेस आर नॉट एबल टू गो इनसाइड प्रॉपर्ली, और जब ऑक्सीजन प्रॉपर्ली अंदर नहीं जाएगी गाइस, इट लीड टू हाइपोक्सिया. So that is how this mountain sickness is actually occurs due to the less barometric pressure at high altitude area. Now this important altitude area की क्वेश्चन आता है दिमाग में कि सर above which height this high altitude sickness is actually starts. So all the time, please remember the reference value of this high altitude is that the altitude should be more than 2500 meter or either 8000 feet. So इसके नीचे जब तक अपन रहेंगे, there will be no any sickness. But when we are going above this height, guys, the sickness will be start. So every time the examiner gives you in the MCQ that the person is going towards the 3000 meter height or the 5000 meter height, and this condition is actually happens. So this is the reference value which you should know, right? Now the physiological concept at high altitude. Just now I told you that whenever you are going at the high altitude area, what is happening guys, that due to this condition the barometric pressure is going to drop, and this lead to decrease oxygen partial pressure in the air, and no oxygen can go properly inside, leading to hypoxemia. Guys, this hypoxemia, in the previous video I told you about the chemoreceptor and the baroreceptor concept. So this hypoxemia is ultimately trigger the chemoreceptor, जो यहाँ पे सेंसर भगवान ने लगा रखा था ऑक्सीजन को चेक करने वाला. This will trigger to this chemoreceptor, and this chemoreceptor which is situated into the aortic area and into the carotid area, guys, whenever these are going to be triggered, this will ultimately lead to hyperventilation. So this hyperventilation will be start. And now what is happening, in inspiration there is no oxygen. ऑक्सीजन तो है नहीं, तो ऑक्सीजन तो अंदर जा नहीं रही है, लेकिन हाइपरवेंटिलेशन के कारण पे अंदर से जो CO2 निकल रही थी, the CO2 which is coming out, this CO2 is going to release more and more, and this we known as CO2 washout. Guys, always remember CO2 is acidic gas. So if you are washing out the CO2, इसका मतलब क्या है? That means that you are washing the acid. And if acid is getting out from your body is going towards which side? Your body is going towards the alkaline side. So that's why due to the hyperventilation, we are exhaling more and more CO2. It means we are exhaling more and more acid. So body is going towards the alkaline side, and that's the reason the high mountain area is always lead to respiratory alkalosis condition. And this respiratory alkalosis condition we called as mountain sickness. And due to this condition, that's a lot of clinical symptom is actually comes like the headache, nausea, vomiting, dizziness, all of this condition, right? So I hope now you can able to understand the concept behind this mountain sickness. So this hyperventilation leading to decreased CO2 level in the body, this leading to respiratory alkalosis. Now दिस रेस्पिरेटरी एल्कलोसिस नीड टू बी कंपनसेट. भाई अब एल्कलोसिस हो रहा है तो उसको वापस एसिड की तरफ लेके जाना है टू मेंटेन द पीएच. सो व्हाट बॉडी विल ट्राई टू डू, बॉडी विल ट्राई टू रिलीज द अनदर प्रोडक्ट फ्रॉम द बॉडी विच इज एक्चुअली इन द अल्कलीन प्रॉपर्टी, and this product is actually the bicarbonate, and this bicarbonate is actually excrete through the kidney. So this kidney try to compensate via excrete more and more bicarbonate, and this will actually takes some time to start compensating, और ये immediate नहीं होता है बेटा. So that's why जब भी आप लोग घूमने जाते हैं, लेह लद्दाख कहीं पे भी आप लोग घूमने जाते हैं, you need to acclimatization. आपको कुछ टाइम चाहिए so that your body are able to adapt in that condition, and this is actually starts after 2-3 days. So this is how the body is actually adapt in this high altitude area, we call it as acclimatization. So this acclimatization, this actually leading to what? That's first of all there will be the hyperventilation. Whenever you are reaching at the Ladakh, there will be hyperventilation. This hyperventilation is washing out your CO2 and kidney try to compensating. Just now I told you. The another thing is that जो आपके ब्लड के अंदर आपके ब्लड में ऑक्सीजन को कैरी करके ले जाने वाला कौन होता है बेटा? हीमोग्लोबिन. एंड दिस हीमोग्लोबिन इज एक्चुअली प्रेजेंट विद द आरबीसी. So guys, please pay attention. Body try to increase the number of RBC, और RBC को बढ़ाने के लिए we required a hormone, and this hormone we called as erythropoietin. So body is actually increase the erythropoietin, and once the erythropoietin is increased, the polycythemia is occurs. So ट्रांसपोर्टेशन उसका ढंग से हो जाए. भाई अल्टीमेट गोल क्या है? अल्टीमेट गोल है बॉडी का कि जो सेल है उसको प्रॉपर ऑक्सीजन की सप्लाई मिल जाए. अब हवा में ऑक्सीजन है नहीं, बॉडी के अंदर पे ऑक्सीजन पहुंच नहीं रही, तो बॉडी क्या कर सकती है? हवा में ऑक्सीजन तो ला नहीं सकती. बॉडी क्या कर सकती है? बॉडी एक्चुअली आपकी जो कैरिंग कैपेसिटी है, जो उसको ट्रांसपोर्ट करने वाली जो टैक्सी है, उसके नंबर को बढ़ा सकती है, ताकि जब कभी भी ऑक्सीजन आ जाए वो सारे के सारे उसमें बैठ के और ट्रांसपोर्ट होकर सेल तक पहुंच जाए. सो दैट इज व्हाई एरिथ्रोपोइटिन इंक्रीजेस लीडिंग टू पॉलीसाइथेमिया. सिमिलरली जब वो वहां पे सेल तक पहुंचेगी तो टैक्सी से ऑक्सीजन को उतरना भी है और उतर के उसको सेल में जाना भी है. तो उसके लिए द बॉडी ट्राई टू इंक्रीज द 2,3 डीपीजी, एंड व्हेनेवर द 2,3 डीपीजी इंक्रीजेस, oxygen hemoglobin dissociation curve goes towards the right side, and this helps for better oxygen unloading. कि जैसे कोई टैक्सी में बैठ गया, अब टैक्सी से अगर कोई उतरेगा ही नहीं अपनी डेस्टिनेशन पे, तो बेटा वो क्या आपके डेस्टिनेशन के अंदर पे कोई भी घर में पहुंच पाएगा क्या? नहीं. तो उससे कोई मतलब नहीं है कि टैक्सी पहुंची है कि नहीं पहुंची है. टैक्सी से बेटर उतर के वो अच्छे से आपके घर में पहुंच जाए. दिस इज वी एक्चुअली रिक्वायर्ड. सो सेम वे जब ऑक्सीजन लंग से ट्रांसपोर्ट होके विद द हेल्प ऑफ आरबीसी हीमोग्लोबिन सेल तक पहुंचती है, तो सेल में अंदर जाने के लिए इसको आरबीसी से हटना पड़ेगा, हीमोग्लोबिन से हटना पड़ेगा. सो दिस अनलोडिंग इज एक्चुअली प्रमोट बाय द इंक्रीज ऑफ 2,3 डीपीजी. एंड नंबर नेक्स्ट, to better go inside, there is increase the capillary density and the number of mitochondria, but this is the long term condition. So that is how the body try to adapt in some time. इसलिए जब भी आप लेह लद्दाख घूमने जाते हैं आपको कहा जाता है कि you should take some time to acclimatize in that condition, right guys? So now I hope about this concept of this high mountain area or the high altitude area, now you are easily able to connect with all the condition. So what are the types of this mountain sickness? Let's discuss about this part. So there are total 3 types. In this 3 types we have to be study total. First of all, this is your EMS, we called as acute mountain sickness. Number 2 we called as HACE, high altitude cerebral edema, and number 3 we have to study HAPE, high altitude pulmonary edema. So these are actually your 3 type of this mountain sickness. And this less severe condition, that is AMS, little more severe HACE, and very severe, that is HAPE. So that is how you have to be understand about all this type of the mountain sickness. So let's talk one by one. Number one is acute mountain sickness. The acute mountain sickness, this is the mild condition, and in this condition there is the mild cerebral edema due to the hypoxia. So what are the symptoms of this AMS? This AMS is actually show the symptom that is headache, and this headache is most important or most common symptom, followed by the nausea, vomiting, fatigue, dizziness, or the sleep disturbance, right? So these are the symptom of your acute mountain sickness. Guys, here you please catch the word. Cerebral edema can be mild or it may not be. So if the MCQ is showing the cerebral edema is present, or this is the mild, or this is there is no cerebral edema, it means this condition is known as acute mountain sickness, right? What is the treatment? अब उसको ठीक कैसे कर सकते हैं? तो भैया जिस कारण से आपको गड़बड़ हो रही है, the condition which is causing this mountain sickness, what you can do, just get away from that condition. And in which condition you are getting the mountain sickness? When you are ascending up. जब आप ऊपर जा रहे थे तो दिक्कत हो रही थी, तो सबसे पहला काम क्या करो कि जिस कारण से तकलीफ हो रही है उससे दूर हट जाओ. तो ऊपर जाने से तकलीफ हो रही है तो नीचे आ जाओ. So that is how immediately stop the ascent and start descent down. Right? So start descent and stop ascent. Number two, take the rest and take the oxygen. So that is the treatment of this AMS, that is your acute mountain sickness, right? Now, if talking about the drug, guys, very important part. If we are talking about the AMS, acute mountain sickness, the prophylactic drug or the drug of choice, that is your acetazolamide. Guys, please pay attention. जो मैंने अभी आपको बात करी है, that is your HACE, high altitude cerebral edema, और HAPE, high altitude pulmonary edema. इसमें acetazolamide का कोई रोल नहीं है. Acetazolamide is only and only useful for the AMS, acute mountain sickness. So the drug of choice or the prophylactic drug for this condition is acetazolamide, which actually stimulates the ventilation and it causes the metabolic acidosis, and this actually works on the PCT area of the nephron at kidney, right? Or you can also give the mild analgesic antiemetic. So AMS, the drug of choice is acetazolamide, right? Let's talk about the second type of this mountain sickness, that is your high altitude cerebral edema. Guys, in high altitude cerebral edema, all the previous symptom that AMS, जो AMS में अपन ने बात करी थी, nausea, vomiting, headache, all of this condition, include with that condition, you can also see the ataxia, and that is the most important. देखो वहां पे most important क्या पड़ा था? That is headache. High altitude cerebral edema में most important क्या है? That is ataxia and also confusion and altered sensorium. So if the MCQ is showing there is a headache, vomiting, nausea, ataxia, confusion and altered sensorium, what is the diagnosis? That is high altitude cerebral edema. If MCQ is saying there is a headache, nausea, vomiting and mild cerebral edema, the answer is AMS, acute mountain sickness. So now what's the treatment of this HACE? Guys, the treatment of this HACE is again the best treatment, that immediate descent, right? जिस कारण से तकलीफ हो रही है उससे दूर हटो, तो अगर ऊपर जाने से तकलीफ हो रही थी वापस नीचे आओ. And that was the question which asked in the previous FMG examination, that condition is given by a lady is going towards the Leh Ladakh at this certain mountain area, and this lady is having that condition, and what is the immediate next management of choice? So the immediate next management of choice was the rapid descent, right? Rapid descent or going downside. Number two treatment is oxygen, and if we talk about the drug of choice over here is dexamethasone, right? So guys, please pay attention. AMS के अंदर मैंने आपको बताई drug of choice is acetazolamide, and HACE के अंदर मैंने आपको drug of choice बताई, that is your dexamethasone. HACE means high altitude cerebral edema. So the drug of choice of this condition is dexamethasone. Now the third type of mountain sickness is high altitude pulmonary edema, HAPE. Guys, please pay attention. In the HAPE, what is going to be happen? That in HAPE, you can see that this causes hypoxic, there you can see the hypoxic pulmonary vasoconstriction. तो इसके अंदर क्या क्या दिखेगा, देखिएगा, प्लीज पे अटेंशन। अर्लियर एएमएस के अंदर अपने को क्या दिख रहा था, हेडेक, नोजिया, वॉमिटिंग एंड ऑल ऑफ दिस कंडीशन। इन हेस के अंदर अपने को क्या दिख रहा था, सेरेब्रल एडिमा में एटेक्सिया and mental confusion, altered sensorium, all of this condition can be seen. But in pulmonary edema, high altitude pulmonary edema, you will see the dyspnea, cough and cyanosis and crackles will be there, right? Crackles will be there. So guys, please pay attention. Here you can see the dyspnea because due to the pulmonary edema condition, you will see the cough, you will see the cyanosis and the crackles. So if the MCQ saying the person going at the high mountain area and the person is having headache, vomiting, nausea, altered sensorium and dyspnea, cyanosis, cough, what will be the what will the most probable diagnosis? The answer is HAPE, high altitude pulmonary edema. Guys, again, if we talk about the treatment part, there is no acetazolamide is going to be function. So the drug for the HAPE is different. So the treatment, the first treatment is again immediate descent. Second treatment, you have to give the oxygen, and the third treatment, you have to give that drug called as Nifedipine, and this Nifedipine is actually the calcium channel blocker. This is dihydropyridine receptor blocker, so that is your Nifedipine, right? This will lead to decrease the pulmonary artery pressure, so pulmonary edema will be less and dyspnea will be less. So that is how in this condition, in the HAPE, you have to give the drug we call as Nifedipine. So guys, you can easily understand, अगर AMS की बात होती है, answer should be acetazolamide. अगर HACE की बात होती है, high altitude cerebral edema, the drug which you have to give, that is your, yes guys, that is your, yes, that is not acetazolamide, that is not acetazolamide, yes, डेक्सामेथाजोन, राइट, डेक्सामेथाजोन। और हेप के अंदर पे आपको क्या देनी है बेटा, निफेडिपिन। सो इन द हेप यू हैव टू गिव द निफेडिपिन। सो प्लीज रिमेंबर, क्वेश्चन किसी भी तरीके से पूछा जा सकता है। नॉट ओनली द मग अप, द ड्रग ऑफ चॉइस फॉर माउंटेन सिकनेस इज एसिटाजोलामाइड। मोस्ट ऑफ द स्टूडेंट डू द मिस्टेक्स, और जब एमसीक्यू आता है मोस्टली दे डू दिस मिस्टेक रिपीटेडली एंड एमसीक्यू गेट्स रॉन्ग। सो आई होप नाउ all this funda is clear, and now onwards if any MCQ comes in any exam, nobody will do this mistake, and this is the most repeatedly asked topic in the various examination by the examiner. So guys, let's talk about the high yield point. So drug of choice of prophylaxis of mountain sickness is acetazolamide. Best treatment, descent to lower altitude. In HACE, the best drug, dexamethasone. In HAPE, the best drug, nifedipine. And hyperventilation causes respiratory alkalosis initially, and polycythemia occurs due to increase the EPO, erythropoietin, right? So I hope guys you understood all of these conditions. So let's quickly practice few MCQs related to this mountain sickness so that you can able to understand how the MCQ can be applied. So let's talk about the MCQ. The first MCQ, a 28-year-old trekker develops headache, nausea, dizziness and insomnia after reaching 3200 meter altitude. Examination is otherwise normal. What is the most appropriate prophylactic drug? Guys, you can see over here. The height is given, that is more than 2500 meter. It means high altitude area. Now you can see the condition is showing headache, nausea, dizziness, insomnia. That is everything is related with what? That's everything related with the AMS, acute mountain sickness. And what is the drug for acute mountain sickness? The acute mountain sickness drug you have to give the acetazolamide. So the right answer of this question is acetazolamide, right? So I hope no confusion now onwards. Everybody is totally understood this concept. Let's practice the another MCQ. A 35-year-old climber develops confusion, ataxia and altered sensorium at 4500 meter altitude. What is the likely diagnosis? Again you can see guys, again you can see 4500 meter, 4500 meter की height दे रखी है. It means it is more than 2500 meter, means mountain sickness condition. Now what is the symptoms? Symptoms is given confusion, symptoms is given the confusion, ataxia and altered sensorium. Confusion, ataxia, and altered sensoria, right? So this is actually the condition of what? This is the condition of HACE, high altitude cerebral edema. That is high altitude cerebral edema, right? So you can see over here, the right answer of this question is option number C, that is high altitude cerebral edema, right? So I hope now everybody understood how to apply this such question, and now onwards you are not going to any confused related to this mountain sickness MCQs. Let's practice one more MCQ. A patient at high altitude develops severe dyspnea, cough, cyanosis, and bilateral crackles. The pathophysiology is, guys, you can see the dyspnea, cough, cyanosis. This is all condition is seen in which condition, which type? HAPE, high altitude pulmonary edema. And guys, in this pulmonary edema, there is actually the vasoconstriction. There is the vasoconstriction, right? So you can see over here, the right answer of this question is hypoxic pulmonary vasoconstriction, right? Now, so right answer of this MCQ is C. Let's practice one more MCQ. A patient with high altitude pulmonary edema requires pharmacological treatment to reduce pulmonary artery pressure. What is or which is the drug is preferred? So you can see in the MCQ, उसने अपने को diagnosis दे दिया कि this is high altitude pulmonary edema, means this is the clear cut case of HAPE, and you can see the examiner is trying to ask that about the drug, pharmacological drug, and we know in HAPE the drug which we have to give, that is Nifedipine. So right answer of this MCQ is A, that is Nifedipine. So dexamethasone we give in HACE. Acetazolamide we give in AMS. So you can see AMS is acute mountain sickness, HACE is high altitude cerebral edema, and HAPE is high altitude pulmonary edema. So guys, now if any MCQ comes, उसको फोड़ देना है and कुछ सी चीज की टेंशन नहीं लेनी है. Now you are having a solid concept about this mountain sickness condition. So I hope you like this video. So if you like this video, guys, please subscribe and share this channel, and also try to send to your other friend as well, so that they can also able to understand about the concept of this mountain sickness. So this is all from this video. Thank you very much.